Om Tham Dhanvantare Namaha. Karpura Gauram Karunavataram Sansarasaram Jagendraharam Sadavasantam Hridayaravinде Bhavam Bhavani Saitam Namami. Today's topic is benefits of yoga therapy. Yoga system of medicine that is originated in India. The Adya Pravartaka being Maharshi Patanjali, and there is a lot of research also has been conducted in yoga therapy. Yoga. So in 1883, Swami Vivekananda went to US, Chicago, and he had made the people familiar with yoga. Now, recently, International Yoga Day has been celebrated in all over the world. It is 9th International Yoga Day. So we will discuss the yoga. So there are types of yoga: Ashtanga Yoga, Raja Yoga, Karma Yoga, Hatha Yoga, etc. Types of yoga. Mental health problems such as depression, anxiety, stress, and insomnia are among the most common reasons for individuals to seek treatment with complementary therapies such as yoga. Yoga encourages one to relax, slow the breath, and focus on the present, shifting the balance from the sympathetic nervous system and the flight or flight response to the parasympathetic system and the relaxation response. Latter is calming and restorative. It lowers breathing and heart rate, decreases blood pressure, lowers fat tolerance, and increases blood flow to the intestines and vital organs. Increased activeness, lower irritability, and an optimistic outlook on life can develop. Practice of yoga generates balanced energy, which is vital to the function of the immune system. Yoga instructor instructing the patient. Second, the practice of yoga generates balanced energy, which is vital to the function of the immune system. Yoga leads to an inhibition of the posterior or sympathetic area of the hypothalamus. The inhibition optimizes the body's sympathetic responses to stressful stimuli and restores autonomic regulatory reflex mechanisms associated with stress. Yogic practices inhibit the areas responsible for fear, aggressiveness, and rage, and stimulate the rewarding pressure centers in the median forebrain and other areas, leading to a state of bliss and pleasure. This inhibition results in lower anxiety, heart rate, respiratory rate, blood pressure, and cardiac output in students practicing yoga and meditation. Consistent yoga practice improves depression and can lead to a significant increases in serotonin levels, coupled with decrease in the levels of monoamine oxidase, an enzyme that breaks down neurotransmitters and cortisol. A range of therapeutic approaches is available for the management of depressive disorders, but many patients turn to complementary therapies due to the adverse effects of medication, lack of response, or simply preference for complementary approach. Number of studies demonstrate the beneficial effects of yoga interventions on depression, stress, and anxiety. Improved flexibility is one of the first and most obvious benefits. With continued practice comes a gradual loosening of the muscles and connective tissue surrounding the bones and joints. This is thought to be one reason that yoga is associated with reduced aches and pains. Yoga helps to build muscle mass or maintain muscle strength. It protects from conditions such as arthritis, osteoporosis, and back pain. During a yoga session, joints are taken through their full range of motion, squeezing and soaking areas of cartilage not often used and bringing fresh nutrients, oxygen, and blood to the area. This helps to prevent conditions like arthritis and chronic pain. Without proper sustenance, neglected areas of cartilage will eventually wear out and expose the underlying bone. Numerous studies have shown that asana, meditation, or a combination of two reduced pain in people with arthritis, carpal tunnel syndrome, back pain, and other chronic conditions. Yoga also increases proprioception and improves balance. Yoga increases blood flow and levels of hemoglobin and red blood cells, which allows for more oxygen to reach the body cells, enhancing their function. Yoga also thins the blood, which can decrease the risk of heart attack and stroke, as they are often caused by blood clots. Twisting poses bring out venous blood from internal organs and allow oxygenated blood to flow in when the twist is released. Inverted poses encourage venous blood flow from the legs and pelvis back to the heart and then pump through the legs, lungs, which it becomes specially oxygenated. Inverted poses encourage venous blood flow from the legs and pelvis back to the heart and then pump through the lungs where it becomes freshly oxygenated. Many studies show yoga lowers the resting heart rate, increases endurance, and can improve the maximum uptake and utilization of local oxygen during exercise. Consistently getting the heart rate into aerobic range lowers the risk of heart attack. While not all yoga is aerobic, even yoga exercises that do not increase heart rate into the aerobic range can improve cardiovascular function. While yoga is not a cure for a cancer, nor a definitive way of preventing it, yoga increases physical, emotional, and spiritual wellness and brings about a certain peace of which many cancer patients desire. Yoga, breathing exercises, and meditation can reduce stress, promoting healing, and enhance quality of life of patients with cancer. Growth of tumors and other cancer indicators are exacerbated by stress because it is especially important for people with cancer to reduce and manage stress effectively. Several premises exist as rationale for applying yoga-based interventions in cancer patients. Additionally, in practicing yoga, a fundamental emphasis is placed on accepting one's moment experiences, creating mindfulness, and not forcing the body past its comfortable limits. Having this healthy sense of acceptance is especially important for individuals dealing with life-threatening illness as it decreases stress when experiences from unpleasant symptomatology. Initially, cancer patients likely benefit from the poses themselves, which are designed to exercise each and every muscle, nerve, and gland throughout the body. These poses precisely address the tension. While stimulation is good, Too much taxes the nervous system, and yoga provides relief from excess stimulation and stresses and hectic nature of modern life. Restorative postures, shavasana, pranayama, and meditation encourage pratyahara, a turning inward of senses, which enables downtime for the nervous system. Byproduct often bring improved sleep. Pharmacological treatment of insomnia is often associated with hazardous side effects, such as states of confusion, psychomotor performance deficits, nocturnal falls, dysphoric blood mood, dysphoric mood, impaired intellectual functioning, and daytime sleepiness. Therefore, alternative forms of therapy for improving sleep are becoming utilized more frequently. These alternative therapeutic approaches can be generally classified into three categories: behavioral based educative methods, example, avoiding caffeine or other stimulants before bedtime, relaxation techniques, example, progressive muscular relaxation, yoga and meditation, and formal psychotherapy. Because of its ability to increase relaxation and induce a balanced mental state, yoga has been studied to evaluate its possible effects on sleep and insomnia. In summary, stress has a negative impact on the immune system, and prolonged exposure increases susceptibility to a disease and leads to physical and mental health problems such as anxiety and depression. Practicing yoga and meditation as a means to manage and relieve both acute and chronic stress helps individuals overcome other comorbidities associated with diseases and leads to increased quality of life. As a non-pharmacological form of treatment, yoga-based interventions are an alternative option for the treatment of mood disorders. Further, initiation of yoga as a therapeutic intervention in depressive disorders is also useful in cardiovascular, improve cardiovascular efficiency and homeostatic control of the body. Already so many research has been conducted on painful conditions and other chronic disorders. So it has also relaxation technique. And it is relaxation of the muscles and it is actually effects on stress. So Buddhist philosophy also is helpful for controlling the mind and habit of addiction. Rapidly emerging in the Western world as a discipline for integrating the mind and body into union and harmony, and adopted as a way of life, yoga improves physical, mental, intellectual, and spiritual health. Yoga offers an effective method of managing and reducing stress, anxiety, and depression. And numerous studies demonstrate the efficacy of yoga on mood related disorders. Yoga can also be practiced as a adjunct therapy in non-communicable disorders, lifestyle disorders, and psychosomatic disorders. According to one survey, 36 crores of people are doing yoga regularly in the whole world. Especially in US, 3.6 crores of population are practicing yoga. And about 90% of member countries of WHO are already recognizing yoga and implementing in their healthcare policy. All this is that yoga system of medicine is very useful for the society. It can be helpful for both prevention and cure of the diseases. Thank you for patiently.